Well, we are live at Vive with HSpec. I'm super excited to be talking to Roy Grossberg, and you are the CEO of Uptake AI.
Correct.
Welcome today.
Thank you. Pleasure to be here.
Yeah. So tell me a little bit about yourself as well as Uptake.
Yeah, absolutely. About myself, my background is software engineering. Software started.
Mine too, by the way.
Really?
Oh yeah.
There you go, brother. I started in Israel, where I'm originally from. Then I crossed to the dark side and joined BCG, been a consultant, and that's roughly when I started with digital healthcare. That's also when I stumbled upon the problem that Uptake today is trying to solve. And spent some time at BCG, spun out a startup from there in the AI startup in the oncology space, had a small exit. Then I joined AstraZeneca, was one of the leaders in the digital health division of the R&D. And when I left, I was kind of looking what I want to do with myself. And it took me a while, but eventually stumbled and decided that I'm going to build Uptake and take it and build and run with it.
That's very cool.
Yeah.
Well, now tell us about Uptake. You were telling me a little bit off camera, and you pulled me in, and I said, quiet, you got to talk on the air.
Correct.
Yep.
So Uptake is an operational intelligence platform. And what it means, essentially, it is a platform, it's a tool that helps hospitals move AI from a pilot stage to let's use it in our real environment stage. And it's a big gap, and it's a gap that hurts all of us. It hurts us as patients because AI doesn't get to be used properly. It hurts hospitals because they're spending a lot of time and money to test these AIs and see if it's clinically valid, but then they're not using it in production for various reasons. And that's what the problem Uptake is looking to solve. And the way we do it is essentially we make it easier, faster, cheaper for hospitals to take AI model, deploy it into their system, integrate it into their EHR or EMR, and then run a monitoring and have guardrails around that AI that really allows them to manage the risk and just know, as one of our potential clients told me, I want to know if I'm providing better care for my patients. I don't know today. And so that's what we're looking to do.
Oh, that's really cool.
Thank you.
So help me understand that better. How is it different than if I were to go and sign up for ChatGPT?
Right.
And just go do that? How is that different?
Well, it's a lot different.
And I realize that, and that's where I want people to hear how it is.
Yeah, absolutely. So what you see today is people build clinical AI. I want to have AI that detects sepsis, or I have an AI that looks at X-ray images and says, I think there's cancer here. And then you go and you want to sell it to a hospital, and then the hospital will say, okay, let's do a pilot. Like, show me, here's some data, and let's see if it's working or not. And they will clinically validate you. And then that's where people think it's like, oh, we made it to the finish line. But in reality, this is the starting line. Because now the doctors are convinced, but okay, let's see how it moves into our environment and how can we use it and how can we use it in our workflows. This is where Uptake comes into play. We are not AI or clinical AI. We do not practice medicine. We are a mechanism that allows the hospital to use those the AI models and vendors.
Nice.
Does that answer your question?
Yeah, that does answer. So is it a software as a service? Is it installed on premise, or what solution?
Yeah, so we're healthcare native, and we know hopefully most of the challenges that come with running in a hospital environment. So we are hybrid model. You can deploy it completely in a hospital, completely on our cloud, or a hybrid solution. We speak Fire and Agile 7 natively. We understand software as a medical device and what it means to handle the data and processes that come along with being a software as a medical device. So that's kind of how we do it.
Yeah. And before, organizations, as they're challenged with, there's a lot of them that want to use these models,
right?
But they end up with this friction of why can't they scale? So help the audience understand why is that a big challenge? Why can't they scale? What ends up?
Yeah, well, Now we're getting into it, right? So let's say I built a sepsis detection model. I go to you're the hospital, and I've was able to convince you that clinically my model is good. Now the fun starts, which means you're gonna tell me go and let's do vendor qualification. It's gonna take 3 months, and then let's do cybersecurity analysis. It's a 200 questions that I have to answer, and then you're gonna tell me awesome. Now integrate into Epic or Cerner or whatever you have. And that's another, God knows, 6 months. Let's go easy on them. 6 months, and now you can actually work. If you use Uptake, all you need to do is like the IT team goes and import an AI model into the Uptake platform. They spend some time configuring it, telling it, here's the data that you need to bring for this model. Here's the data that you need to bring for the other model. Here's what triggers the event, and then we take care of everything else. And then once you have the model in the Uptake environment, you can run it in shadow mode, meaning you can test it safely. And once you're convinced that it's working with your data, you launch it. But the launching it is where it becomes really interesting. Because now one of the problems that I've seen talking with significant number of health systems is a year after the AI has been launched or used, there's not a lot of information. Is it doing what it's supposed to? Is it really providing the care that we want to our patients? And that's really the reason why we have AI at all, right? We want to improve our care. So what was the accuracy in January versus April? There was an EMR upgrade in between. Did things change? What's your drift? Like it was 94% accurate and today is 88. Do you know? And B, if you know, do you know why? How does it behave? What are the biases that you have? Maybe it's very accurate for male over 65, but for women 30 to 35, it's not so accurate. And do you know? And do you know who has been impacted by it? All of those questions, to some degree, you can find answers, but not in a systematic, scalable way. And Uptake, being the system of record at the hospital, will allow IT manager, risk officer, chief medical officers to get those answers, and also help the vendors improve themselves. Hey, Mr. Vendor, your model is not operating or is not performing as well as it does for this subcategory of population. Take a look into it.
Very interesting. Yeah. That's cool. And so you're at Vive. What are you looking to accomplish at Vive, and how has it been so far for you?
Oh man, we talked about it. It has been very busy with meetings. We're meeting right now with two categories. One, we're raising money, so we've been bootstrapped so far, and now with this strong pool that we get from the market, it's time to bring an institutional investor. So that's going pretty well, and we're looking for our building client relationships. So talking with CIOs, IT managers, VP of applications at health systems and community hospitals, and kind of introducing them to the concept. There's a lot of questions, but there's a lot of interest as well, which keeps me
great.
positive.
That's awesome.
Yeah, it is.
So how can they learn more if they hear this and they're like, oh, I'm really intrigued. I want to learn more about
GetUptake.ai or Roy@GetUptake.ai, and that's how you reach us.
Awesome. Yeah. Very cool. Well, I really appreciate you coming around, Roy.
Thank you.
I'm interested in looking at Uptake. I'm going to go to the website. I'm going to check it out. I might shoot a message too.
Excellent.
And I hope you do
Please
too.
do.
So check it out.
Yeah,
GetUptakeAI.com.
GetUptake.ai.
GetUptake.ai.
Yeah,
awesome.
that's where we're at.
Check it out.
Thanks,
Roy.
Appreciate that.